Hello, everyone. I hope everyone can hear me. Okay. Hello and welcome to the UNAIDS Asia Pacific World AIDS Day 2023 report launch and virtual communities share fair. Let communities lead. My name is Alonzo Wurtzbach, and I am the UNAIDS Asia Pacific Goodwill Ambassador. And I'm so pleased to welcome here community leaders from all across the region, as well as journalists to this event just ahead of World AIDS Day. And I'd also like to give a shout out to everybody watching online right now and from all over the world. Thank you and welcome. So I have a couple housekeeping updates. First, there is interpretation in Burmese, Khmer, Indonesian, Thai, and Vietnamese. And if you have any questions, please put them in the chat box below. This is an interactive activity, and we welcome your questions, of course. Okay, much of the progress made against the HIV pandemic over the last 40 years is thanks to the efforts of community organizations. However, this report reveals that communities working to end AIDS are often too unrecognized, unresourced, and under attack. So, to begin with an overview of the report and key regional analysis we begin with an overview of the report and key regional analysis from Eamon Murphy, UNAIDS Regional Director to the Asia Pacific and Eastern Europe Central Asia regions. Eamon, are you here? How are you?
Well, and good to see you again, Pia. Great to see you.
Good to see you too. And thank you for joining us today. Please.
Thank you. Thanks very much, Pia. I'll just bring up the slides. But it's great to see so many colleagues from across the region here to discuss this very important topic that is the focus of a very different World AIDS Day report, letting communities lead. So it is a report with a difference. It celebrates the contributions that communities of people living with HIV, key populations and civil society organizations have made to the response to HIV from the very beginning. But the report also makes the case for countries to do more, to center, to fund, and facilitate the work of the communities. Why? Because community-led organizations deliver the results that no other entity can. Their leadership is crucial in reaching the people being left behind. Countries that have made the biggest advances and the greatest impact in responding to the HIV epidemics are those who have worked with the communities at the center. Most of you are aware of the global AIDS strategy targets relating to HIV services and societal enablers. The 95 goals push us collectively to achieve, for all relevant populations, 95% coverage of combination prevention, HIV testing, treatment and viral suppression, services for eliminating mother-to-child transmission or vertical transmission, and sexual and reproductive health services. The 10-10-10 targets call on us to ensure that less than 10% of countries have punitive laws and policies. Less than 10% of people living with HIV and key populations experience stigma and discrimination. And less than 10% of women, girls, and key populations experience gender inequality and violence. These 10-10-10 targets are for part of the political declaration of 2021 that member states agreed to, and yet they're a long way from achieving these targets. As the report mentions, in many places, the law reform work is being spearheaded by communities. This year, the Cook Islands Parliament in the Pacific decriminalized consensual sex between men, thanks to the strategic advocacy of Pride Cook Islands and Te Tiare Association. Communities have also headed legal challenges to discriminatory laws, some going back many, many years. This includes in India, where in 2018, the Supreme Court struck down Section 377 of the Penal Code, which prohibited sex between men, a law that is in many different countries across our region, or adapted in their legal codes. So it's a landmark change that community spearheaded that we should see other countries follow. A key dimension of this work is access to justice. The report cites the example of street law, PH, in the Philippines, which trains people who use drugs and are in prisons to act as jail paralegals. A lot of people are on many years in jails in the Philippines for many years on remand without sentence. And so the paralegals have a really important role to help them. They help navigate cases through the justice system and document concerns around access to justice. The 10-10-10 targets recognize a truth that we have long understood around HIV. It's not just a health issue, and it is not addressed merely by providing health services. We must break down the structural barriers, blocking the full enjoyment of human rights, gender equality, and lives to be able to be lived free from abuse, injustice, or prejudice. This World AIDS Day report also brings into sharp focus the 30, 80, 60 targets. Not enough of us in the AIDS response are steadily advocating for these goals, which specifically relate to community leadership. Through the 2021 political declaration on HIV and AIDS, governments have already promised to ensure that 1, community-led organizations will deliver 30% of testing and treatment services. This includes a focus on linkage to care, adherence and retention support, treatment and literacy, and of course, testing itself in all its forms. 2, community-led organizations should deliver 80% of HIV prevention services in the community for people from key populations at high risk of infection. So that's important to keep in mind. 80% of prevention services they've committed to being led by the community. And finally, 3, community-led organizations should deliver 60% of programs to support the achievement of the societal enablers. We're a long way from that, and we're going to hear from colleagues across the region with their lived experience. These targets are not inferior, of course, to the 95s or the 10s. In fact, they are absolutely essential to unleashing the true potential of the powerful HIV prevention and treatment services that we now have at our disposal. Many advances, but they're being held back because of the lack of focus on the role of the community. This year's report calls for policymakers to recognize and support community leadership. Unfortunately, in many places, the work of communities, as Pia said in her opening remarks, is under-supported, under-resourced. People are under-remunerated, not paid adequately for the work they do, and even under attack. The report shares new UNAIDS financial estimate findings that funding to communities has declined sharply, as you can see on the screen. This is the clearest indicator that the world is not making good on its commitment to prioritize community leadership in the AIDS response. Over the last decade, we've seen a reduction of the HIV resources, that's all forms of resources, going to community-led organizations. Globally in 2012, around 1/3 of all HIV funding was channeled through community-led organizations. Now in 2021, that's reduced to just 20%. To give some regional perspective, I'd like to share some Asia-Pacific data. This graph shows that there is an inadequate investment in key population HIV prevention programs. The green lines represent the key population prevention spending, most of which should be implemented by key population-led organizations. But in every single country, these investments are inadequate to the need, despite the commitments made by the countries to the political declaration, both domestic and international resources. But what is the need? Here in Asia Pacific, 95% or 96% now of new infections are among key populations and their sexual partners. More than any other region, it is imperative that the vast majority of our HIV prevention funding is channeled through key population-led organizations best placed to reach those most at risk. Think of the environment people are living in today. Many of them are not accessing services that were available and more open to the communities in the past. So they need to be able to access these in ways that they feel safe. So we need community-led organizations, key pop-led organizations to be at the forefront. And as you can see, almost half of the new infections are among men who have sex with men. Therefore, funding to MSM and LGBT-led organizations should reflect this, but it doesn't. Of particular concern for Asia-Pacific is the rising epidemic among men who have sex with men in several countries and across the region as a whole, and the slow decline in others. These are, here on the graph, 6 countries from the region. If you focus just on the dark green line, it represents the trend in new infections among MSM. You can see that it is either rising or fairly flat. You can also observe that the faster downward trend and lower rates of infections among other population groups. So there's a mismatch in where the resources are being used and the types of programs that are needed to be implemented. In Cambodia, Indonesia, Myanmar, Lao PDR, the Philippines, and Thailand, youth from key population communities aged between 15 to 24 make up around half of the estimated new infections. Do the programs match that? And since 2010, new infections in the ages 15 to 24 have risen. Next slide, please. Have risen in Afghanistan, Bangladesh, Fiji, Papua New Guinea, and the Philippines. And when you look at these countries, these are the countries with the fastest growing epidemics in the region. And so there's no programmatic link between where the focus is. And you can see on this slide, those same countries in red. Our reality is that HIV prevention progress for Asia Pacific has virtually stalled. Since 2010, there has been just a 14% reduction for the region as a whole. In places with rising epidemics, as you can see in the red, we need an urgent focus on concrete, population-specific interventions led by the communities themselves. These countries include Bangladesh, Afghanistan, Papua New Guinea, Fiji, and the Philippines. In other countries, we must also leverage the power of communities to accelerate the progress. As you can see in the green, many of these countries are not reducing new infections anywhere near fast enough to have the community protection needed. The report cites a 2022 study from Thailand, which shows that key population-led organizations are most effective for scaling up PrEP access. In the Philippines, peer-led demedicalized PrEP services have helped double enrollment. The work can be spearheaded at the local level as well. And in Vietnam, we now have a strong example of using social contracting to deliver community-led harm reduction, HIV testing and referral services for HIV treatment and methadone. So we know it can be done, but we're not seeing the scale of investment to achieve the results required. We need to unleash the full power of communities to improve our testing linkage to care and treatment retention, as well as viral suppression outcomes, as you can see from this graph. In 2022, 22% of people living with HIV in this region were unaware of their status. 35% of people living with HIV are not accessing treatment, and 38% of people have not achieved suppressed viral load. We need to reflect on what is holding people back. Why are they not accessing services that should be readily available? Communities are best placed to help us close these gaps. The report cites and refers to the contribution of community-led organizations to a 4-fold increase in testing in China, for instance, including by driving demand through online tools. We know it can be done. We know how it can be done. It also speaks about the work of community organizations in countries like Myanmar to support treatment continuity in conflict-affected areas. As you can see in this next graph, several countries, significant proportions of people who have already been diagnosed are not on treatment. Community-led organizations can provide support for the linkage to care, the treatment literacy needed, and ultimately the treatment adherence. This includes peer-to-peer PLHIV services, in person or online, as the need is for the people most in need. Here also, I want to mention the importance of community-led monitoring. The report references the excellent regional strategic direction and capacity building spearheaded by the 7 Alliance, and we'll hear from them today. By creating a feedback loop between service users, health service providers, and policymakers, we can steadily improve HIV service offerings. But we must first commit to funding community-led monitoring and to implementing its recommendations. And the 7 Alliance is holding the second regional meeting on community-led monitoring in 2 weeks' time, and we're looking forward to the results of that. But we need to see the countries implement the recommendations and fully resource it at the scale required. The overarching message of this report is that we can end AIDS as a public health threat, with communities leading the way, as they have done in the most successful responses. There are 3 broad advocacy priorities. The first, communities must be at the center of the formulation, the budgeting, the implementation, and the monitoring and evaluation of all plans, policies, and programs that affect them and are designed or should be designed for them and with them. Secondly, community roles must be fully and sustainably funded, and people implementing community-led programs should be properly remunerated, paid at the right level, be they a peer educator or someone working in the office, the right level of funding and salary to support them. And 3, we must remove barriers to community leadership roles by ensuring that the civil society space is there and it's protecting the human rights of all people. One of the wonderful features of this year's World AIDS Day report, and what makes it different from the past, is that it includes 9 personal essays, powerful essays from community leaders across the world. I'm pleased to say that 2 of these are from our own region. Harry Prabowo from the APN Plus, who's the program manager of the Asian Pacific network of people living with HIV, writes on your behalf about the need for adequate, sustainable financing for community-led service delivery, community-led monitoring and advocacy. And Bhagya Lakshmi, who's the secretary of the Ashadaya Samiti, shares a personal story of finding her voice as a sex worker activist. Through political advocacy, Indian sex workers have gained a say in key policies that affect their lives today. We're honored to have Bhagya here with us from Karnataka. Apologies for mispronouncing your town, but she's going to introduce herself, and the interpreter will share her message in English. So I'm pleased to be able to turn from the report to the real lived experience of people from our region. So I hand the floor to Bhagya. Thank you very much, Pia.
Thank you, sir. ನಮಸ್ತೆ. ಈಗಾಗಲೇ ನಾನು ಪರಿಚಯ ಆಗಿದೆ. ನಾನು ಇವಾಗ ಬೆನ್ಗೂ ಮತ್ತೆ ಮಸ್ಗೂ ಮತ್ತೆ ಡೇವಿಡ್ ಸರ್ಗೂ ಮತ್ತೆ ನಂದಿನಿ ಮೇಡಮ್ಗೆ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ತಿಳಿಸ್ತಾ ಇದ್ದೀನಿ ಸರ್.
Thank you very much, sir. Special thanks to David, Ben, and Murphy and Nandini madam to provide this opportunity to speak to on behalf of our community.
ಕಮ್ಯುನಿಟಿ ಲೀಡ್ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ, ನಂಗೆ ತುಂಬಾ ಖುಷಿ ಆಗುತ್ತೆ. ಕಮ್ಯುನಿಟಿನೇ ಲೀಡ್ ಆಗಿ ಮುಂದಾಳತ್ವ ತಗೊಂಡು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಎಲ್ಲಾದ್ರಲ್ಲೂ ಇನ್ವಾಲ್ವ್ ಆದ್ರೆ ತುಂಬಾ ಖುಷಿ ಸರ್. ಅದು ಪ್ರೋಗ್ರಾಮ್ ಸಕ್ಸಸ್ ಆಗೋದಕ್ಕೆ ಒಂದು ಒಳ್ಳೆ ಒಪಿನಿಯನ್ ಇರುತ್ತೆ ಸರ್.
Yeah, this year theme is about let community lead. It's very important, like after so many years that everyone recognized that community should take lead in all the activities of prevention or HIV, in end HIV.
ಎಲ್ಲದಕ್ಕಿಂತ ಮುಖ್ಯವಾಗಿ ನಂಬಿಕೆ ಅನ್ನೋದು ಮುಖ್ಯ. ನಂಬಿಕೆ ಅನ್ನೋದ್ರಿಂದಲೇ ನಾನು 20 ವರ್ಷದಿಂದನೂ ನನ್ನ ಸಮುದಾಯದ ಮೇಲೆ ನಾನು ನಂಬಿಕೆ ಇಟ್ಕೊಂಡಿದ್ದೀನಿ. ನಾನು ಪ್ರಾಜೆಕ್ಟ್ ಮೇಲೆ ನಂಬಿಕೆ ಇಟ್ಕೊಂಡಿರೋದಕ್ಕೆ 20 ವರ್ಷದಿಂದ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮ ಚೆನ್ನಾಗಿ ನಡೀತಾ ಇದೆ ಸರ್.
Yeah, to let the community lead is very essential. If people are trusting us, like we can do better program than others. If they have that trust on us, definitely it's going to give better results.
ಇದೆಲ್ಲ ಮಾಡ್ಬೇಕಾದ್ರೆ ಹಣದ ವ್ಯವಸ್ಥೆ ಬೇಕಾಗುತ್ತೆ ಸರ್. ಅದು ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಏನೇ ಒಂದ್ ಕೆಲ್ಸ ಮಾಡ್ಬೇಕಂತಂದ್ರು ಹಣ ಮುಖ್ಯ ಆಗಿರುತ್ತೆ. ಯಾಕೆ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂತಂದ್ರೆ, ಉದಾಹರಣೆಗೆ ಹೇಳ್ಬೇಕು ಅಂತಂದ್ರೆ ಮೊದ್ಲಿಗೆ ನಮ್ಗೆ 2005ರಲ್ಲಿ DIC ನ ನಮ್ಗೆ ಕೊಟ್ರು. ಆ ಒಂದ್ ಸಂದರ್ಭದಲ್ಲಿ ನಮ್ಗೆ ತುಂಬಾ ಅನುಕೂಲ ಆಯ್ತು.
Yeah, to lead from the front, we have to be make sure that the committed resources are available to the community so that they can do better services to the community. And I can give an example, like when we started the program, that we have given a chance to run a DIC, so that this trust and the committed resources given to us to run a drop-in center, and we involve many community members to take part in that drop-in center and share their experience and come up with the new ideas.
ಮತ್ತೆ ಕೊರೋನಾ ಟೈಮ್ ಅಲ್ಲಿ ನಮ್ಗೆ ಒಂದು HIV ಸಂಬಂಧಪಟ್ಟಂಗೆ ತುಂಬಾ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ಕೊರೋನಾ ಟೈಮ್ ಅಲ್ಲಿ ನಾವು ಮಾಡಿದಂತ ಸಂದರ್ಭದಲ್ಲಿ ಡೆಲ್ಲಿ ಹೆಲ್ತ್ ಅಂತ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ಮಾಡ್ದೋ. ಅದು ಆ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ತುಂಬಾ ಸಕ್ಸಸ್ ಆಯ್ತು. ಆ ಸಕ್ಸಸ್ ಆಗೋದ್ರ ಜೊತೆಲಿ ಮತ್ತೆ ನಮ್ಮ ಕಮ್ಯುನಿಟಿ ಅವ್ರಿಗೂ ತುಂಬಾ ಅನುಕೂಲ ಆಯ್ತು ಅದು.
So during the corona also, like during that phase, that the power has given to us to run a telehealth. So that because lot of community members are not able to come to the access of services, so we provided innovative ideas used for that telehealth we provided during that time.
ನಾನೊಂದು ವಿಷಯ ಹೇಳಕ್ಕೆ ತುಂಬಾ ಇಷ್ಟಪಡ್ತೀನಿ. ಮೊದಲನೇದಾಗಿ ನಾನೊಂದು ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಆಗಿದ್ದು, ನಂಬಿಕೆ ಅನ್ನೋದು ಇಡ್ಬೇಕು, ಮತ್ತೆ ಹಣದ ವ್ಯವಸ್ಥೆ ಬೇಕು, ಮತ್ತೆ ಅಧಿಕಾರ ಅನ್ನೋದು ಇದೆಯಲ್ಲ. ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ನಡೆಸೋದಕ್ಕೆ ಒಂದು ಅಧಿಕಾರ ಬೇಕಾಗುತ್ತೆ. ಅದನ್ನ ದಯವಿಟ್ಟು ಈ ಒಂದು ಡೆಲ್ಲಿ ಇದ್ರಲ್ಲಿ ಕಲ್ಸ್ಕೊಟ್ರೆ ನಮ್ಗೆ ತುಂಬಾ ಅನುಕೂಲ ಆಗುತ್ತೆ.
Yeah, I would like to bring here the three important things that people should trust us, and people should provide the financial resources to them, and give a power to the hands of to the community, so that they do better than anyone.
ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಹತ್ರ HIV ನ ತಡೆಗಟ್ಟೋದಕ್ಕೆ ಹಲವಾರು ಕಾರ್ಯಕ್ರಮಗಳು ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಅಲ್ಲೇನೆ ಇರುತ್ತೆ. ಒಂದು ಕ್ಲೈಂಟ್ ಗೆ ಯಾವ ರೀತಿ ಮನವೊಲಿಸ್ಬಿಟ್ಟು ನಾವು ಕಾಂಡಮ್ ನ ಯೂಸ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದನ್ನ, ಒಂದ್ ಬಾಯ್ ಫ್ರೆಂಡ್ ಆಗಿರ್ಬೋದು, ಒಂದ್ ಹಸ್ಬೆಂಡ್, ಅದೆಲ್ಲ ಏನಂತಂದ್ರೆ ಸೆಕ್ಸ್ ವರ್ಕರ್ ಹತ್ರ ಒಂದು ಕ್ಲಿಯರ್ ಅಂತಕ್ಕಂತ ಒಂದು ಇದಿರುತ್ತೆ. ಅದ್ರ ಮುಖಾಂತರ ನಾವು ಅದನ್ನ HIV ನ ತಡೆಗಟ್ಟಬಹುದು.
A single sex worker have a better understanding to convince a client, convince a partner to use condom and take care of their own health. So in that we need to provide all the support to the and all the programs to the hands of the community.
ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಈ ಕಮ್ಯುನಿಟಿ ಮೇಲೆ ನಂಬಿಕೆ ಇಟ್ಟು ಈ ಕಮ್ಯುನಿಟಿಗೋಸ್ಕರ ನೀವು ಪ್ರೆಪ್ ಅನ್ನೋದನ್ನ ಬಿಡುಗಡೆ ಮಾಡಿದ್ರೆ ತುಂಬಾ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಯಾಕೆಂತಂದ್ರೆ ಆ ಪ್ರೆಪ್ ಅನ್ನೋದ್ ಬಂದಂತ ಸಂದರ್ಭದಲ್ಲಿ ನಮ್ಮ ಹೆಣ್ಮಕ್ಳು ಎಷ್ಟು ಸೇಫ್ ಆಗಿದ್ದಾರೆ ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಅನ್ನೋದು ಇವತ್ತಿಗೂ ಆ ಬೇಡಿಕೆ ಅನ್ನೋದು ನಮ್ಮಲ್ಲಿ ಇದೆ.
To prevent and end it, it's very important to provide PrEP to the community members so that they can be protected and prevent from the HIV.
ಮತ್ತೆ ನನ್ಗೆ ಮಾತಾಡೋದಕ್ಕೆ 5 ನಿಮಿಷ ಟೈಮ್ ಕೊಟ್ಟಿದ್ದೀರಾ, ತುಂಬಾ ಖುಷಿ ಆಯ್ತು. ಮತ್ತೆ ಇನ್ನೂ ಒಂದ್ ಸ್ವಲ್ಪ ನಂಗೆ ಟೈಮ್ ಕೊಟ್ಟಿದ್ರೆ ಇನ್ನೂ ಒಂದ್ ಸ್ವಲ್ಪ ವಿಸ್ತಾರವಾಗಿ ನಿಮ್ಗೆ ತಿಳಿಸ್ಕೊಡೋದಕ್ಕೆ ಪ್ರಯತ್ನ ಪಡ್ತಿದ್ದೆ.
And I've given only 5 minutes to speak, and with the translation I'm giving this, and if you have more time you should have discussed in at length.
ಸಾರಿ, ಇನ್ನೊಂದೇ ಒಂದ್ ಹೇಳ್ತೀನಿ. ಸೆಕ್ಸ್ ವರ್ಕರ್ ಸುತ್ತ ಕ್ಲೈಂಟ್ ಇರ್ತಾರೆ, ಬಾಯ್ ಫ್ರೆಂಡ್ ಇರ್ತಾರೆ, ಬ್ರೋಕರ್ ಇರ್ತಾರೆ, ಮತ್ತೆ ಗಂಡ ಇರ್ತಾರೆ. ಇವ್ರನ್ನೆಲ್ಲಾನು ಒಂದು ಕಾಂಡಮು ಮೇಂಟೈನ್ ಮಾಡುತ್ತೆ HIV ನ ತಡೆಗಟ್ಟೋದಿಕ್ಕೆ ಅಂತ ಹೇಳಕ್ ಇಷ್ಟಪಡ್ತೀನಿ.
In our life there are many controllers are there, and I definitely that the community have that kind of strength to control and use condom among them.
ನನ್ನ ಮನಸ್ಸಿಂದ ಬರ್ಬೇಕು, ನಾನು ಕಾಂಡಮ್ ನ ಉಪಯೋಗಿಸ್ಬೇಕು, ನನ್ನ ಆರೋಗ್ಯನ ಕಾಪಾಡ್ಬೇಕು ಅಂತ. ಥ್ಯಾಂಕ್ ಯು ಸರ್, ಇಷ್ಟು ಮಾತಾಡೋದಕ್ಕೆ ನಂಗೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಿದ್ದು ಧನ್ಯವಾದಗಳು.
We have to build within the community that they should come up and in front and use the condom and take their life in their own hands. Thank you for providing this opportunity to speak to in this forum.
Okay, thank you. Thank you very much, Bhagya, for sharing that meaningful insight, and also Amon for sharing with us an overview of the report and key regional analysis. Thank you. Thank you very much.
Thank you. Thank you. Thank you.
All right. So we Now we get a response to the report from the 7 Alliance, our regional consortium of people living with HIV and key population organizations. Speaking on their behalf is Sita Shahi, Regional Coordinator of ICWAP. Hello, Sita, how are you?
I'm good. Thank you so much for thank you so much for inviting me to speak about the current issues that we are working on. So on behalf of 7 Alliance and ICWAP, we want to express our heartfelt gratitude to everyone working on the HIV response. We have come, a long way in our journey and have seen many positive changes, but at the same time lost numerous individuals who were the real and true fighters for people living with HIV and HIV response as a whole. This World AIDS Day themed Let Communities Lead celebrates the community achievements and call for action to empower and support community leaders. While overall awareness of HIV has increased, new forms of stigma and discrimination pose significant threats. Healthcare worker, for example, while more polite, still deny the services. Despite women and girls representing 28% in the region, they are often treated as a mere symbols in the HIV response, facing multiple layers of stigma and discrimination, different forms of gender-based violence. Challenges in our region includes 1,600,000 people are still lacking to access to antiretroviral therapy. And every day, 416 people are dying of HIV/AIDS in our region. And 4 people are dying while I'm speaking here and delivering the messages. So peer navigators are surviving on a very dismal amount of money in daily basis, as earlier Eamon also mentioned about, and where they are really paid $3 to $4 per day, equivalent to a cup of coffee that we are drinking in daily basis. So political decision lack a community representation, hindering the progress in certain countries. Prevention of mother-to-child transmission is low at 57%, and integration of violence against women and HIV program are lagging. The social factors contributing to HIV transmission from parents to child are completely undermined, under-resourced, and under-programmed. Promotion of gender equity is lacking and requires massive scaling up of the gender transformative and a community-led program. Individuals face barriers to accessing services, including travel costs, family objections, workplace discrimination, travel restriction, and obstetric violence, and inadequate support for those who are in disability. The development of integrated community-led approaches is crucial for the well-being of people living with HIV and key populations. Gaps in the advocacy and activism diminish community collectiveness and hinders changes as a whole in HIV response. Communities have so far proved that the HIV response can be significantly strengthened. Community-led responses and placing your trust in the unwavering capacity of the communities. We can assure that we can successfully attain the HIV target by 2030 and permit us to take your rightful place at our rightful place at the forefront of the HIV response, as well as because we hold firsthand knowledge of what works best for us. Thank you so much for our peer educators, outreach workers, counselors, CSOs, funders, allies, members, and community contributors who work real at the ground tirelessly despite of facing various challenges. Last, not the least, let us ensure the heart of the community-led response remains with our community and let the community lead the way. Thank you. Thank you so much.
Thank you. Thank you very much, Sita, for sharing that with us. Now, we welcome questions. Please, everybody, type in your questions in the chat box. I'll be going through them in just a little bit, but I do have some questions here already. And the first question goes to Amon. Many countries have financial challenges and competing priorities. What options should countries explore to increase funding for community-led interventions?
Thanks very much, Pia, and thanks to the colleague who asked the question. We have some good examples where countries are investing in innovative ways. In Vietnam, they've been doing some forms of taxation where the funds then go to public health priorities. And so there are ways of doing it. Some call it the sin tax in some countries. There's other ways that some countries have been tapping a very small percentage of the cost added for airline tickets. There's a whole range of innovative financing. But the most important thing is that the countries invest part of their response, their funding, they have to make the priority decision to fund community and prevention services, because we're seeing too much of the balance going towards the services for treatment only, and we're not going to treat our way out of this epidemic. So there are examples. There are countries that have put it, like Thailand, their health insurance pays for programs, both prevention programs, but also for community to implement. So there are a whole range of ways that we can see within the region and learn from that. Social contracting has been in place in parts of the region for a long time. So that's government funded, but we need to see it at the scale. Thanks very much, Pia.
Thank you for sharing that with us, Amon. I have a question here, and this one is for Bagya. A question from Sundar. Bagya, we need to celebrate the fact that in the region, female sex workers have effectively brought down rates. What did they do differently to achieve this? Please.
One question is that ಈ ರೀತಿಯಲ್ಲಿ female sex workers ಕಡಿಮೆ ಮಾಡಿದ್ದಾರೆ ಏನು ಅದ್ರ ಬಗ್ಗೆ ನಿಮ್ಗೆ ಏನಾಗುತ್ತೆ ಕಡಿಮೆ ಮಾಡಿದ್ರೆ
ಏಕೆಂತಂದ್ರೆ ಇವಾಗ ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ಗೂ ಒಂದು ಅಧಿಕಾರ ಅನ್ನೋದನ್ನ ಕೊಟ್ರೆ ಖಂಡಿತವಾಗ್ಲೂ ಆ ಕಾರ್ಯಕ್ರಮ ಸಕ್ಸಸ್ ಆಗೋದಕ್ಕೆ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಯಾಕೆ ಅಂತಂದ್ರೆ ಮುಂದಾಳತ್ವ ನಿಂತ್ಕೊಂಡು ಮಾಡೋದ್ರಿಂದ ಅವ್ರೇನೆ, ಯಾಕೆ ಅಂತಂದ್ರೆ ಇವತ್ತಿನ ದಿನದಲ್ಲಿ ನಾನೇ ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಆಗಿದ್ರು ನನ್ನ ಪ್ರಾಜೆಕ್ಟ್ಗೋಸ್ಕರ ನಾನು ತುಂಬಾ ಟೈಮ್ ಕೊಟ್ಟು ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಫಿಮೇಲ್ ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ಗೆ ನೀವು ಖಂಡಿತ ನೀವು ಇದೊಂದು ಅವಕಾಶ ಮಾಡ್ಕೊಟ್ರೆ ಸಕ್ಸಸ್ ಆಗೋದಕ್ಕೆ ಅನುಕೂಲ ಆಗುತ್ತೆ.
Majority of the government programs are this one is more focused on other communities rather than the female sex workers. I think now the times has come that we need to give more opportunity for female sex workers, so that involve them in all the things, and so that it will be definitely going to be give results.
ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಫಿಮೇಲ್ ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಒಂದೇ ಆಗಿರುತ್ತೆ. ಯಾಕೆ ಅಂತಂದ್ರೆ ಫಿಮೇಲ್ ಸೆಕ್ಸ್ ವರ್ಕರ್ಸ್ ಒಂದ್ ದಿನಕ್ಕೆ 10-15 ಕ್ಲೈಂಟ್ ತಗೊಳ್ಳೋಂತವ್ರು ಇರ್ತಾರೆ. ಆ ಸಂದರ್ಭದಲ್ಲಿ ನೀವು ಅದನ್ನ ವ್ಯವಸ್ಥೆ ಮಾಡ್ಕೊಟ್ರೆ ತುಂಬಾ ಅನುಕೂಲ ಆಗುತ್ತೆ.
Yes, even female, like majority of the time that they will neglect because they don't have a quality. If you provide that qualities, they have a lot of potential and they come forward and do better. And
ಅವಾಗ್ಲೇ ಹೇಳ್ದಂಗೆ ನಂಬಿಕೆ ಅನ್ನೋದನ್ನ ಇಟ್ರೆ ಖಂಡಿತವಾಗ್ಲೂ ಸಕ್ಸಸ್ ಆಗುತ್ತೆ.
Yeah, definitely. I already mentioned that trust should be on the female sex workers. Thank you.
Thanks, ma'am.
Thank you. Thank you very much. Sita, I have a question here for you as well. The 7 Alliance is spearheading capacity building around community-led monitoring. But what must be done to ensure the recommendations are actually implemented?
Thank you for your question. Whoever raised this question. Actually, on behalf of 7 Alliance, it's really important to work with the community people at the ground level, because we are really strategizing the work at the country level to support our communities and allies. So it's really important to have the resources at the ground level, and country nation, they really need to allocate the budget for those countries who are really implementing at the ground level. And community involvement, I mean the meaningful involvement of PLHIV and all key population in decision making is very much important. So that being said, that the building the capacity, providing the such a platform so that they can share the learnings and build up their knowledge, and then they can replicate at the country level is also another part to really I need to think through. So ultimately I would say there is really a lack of resources at the community level, and we really need to find the way how we can support better at the country level community people.
Thank you. Thank you for sharing that with us, Sita. I see we have a comment here from Nikos Dakanay. I hope I'm saying your name correctly. And perhaps Amon can respond to this question. The question is, the MSN, or men who have sex with men category in public health requires scrutiny. It labels individuals based on behavior rather than identity, addressing health disparities, but oversimplifying a diverse group with varying sexual behaviors, identities, and risk factors. It often neglects the intersectionality of identities such as race, ethnicity, socioeconomic status, and age, leading to unique challenges within different subgroups that need tailored public health interventions. Is there anything you can share about this, Amon?
Thanks, Pia. And Nikos, thank you. I think that's a PhD topic in itself. I wish Sita or someone was responding. It's very true. MSM is a generic term, because one of the things is that people identify in a whole range of different ways, but their behavior is what connects them. I agree with Nikos. There's a much richer understanding around the intersectionalities that need to be brought into play, but that's at country level. But at the overall, we need to look at the behavior, because if we look just at identity, we're not going to capture those at risk. Right? We need to look, where is the high-risk transmission occurring, and it's by behaviors, and quite often by, in the case of MSM, men who do not identify as gay, homosexual, katoi, whatever the term is that is relevant to their identity in whatever place they're living. But what is common to them is the sexual behavior that's placing themselves and others at risk. And so that's why the target records around that. But it's a topic to explore with APCOM and others, and we could have a session just on that by itself, because I fully agree, we often oversimplify, especially for reporting purposes, and it hides a lot of rich understandings that are culturally relevant. Thanks very much, Pia, and thanks, Nikos, for the question.
Okay, thank you, Amon. I just want to read out the comment here, not necessarily a question, but Inad Rendon says, I'm happy to hear that inequitable pay to outreach workers is now being tackled. Promoting community leadership also means equitable employment within the HIV sector. Ensure outreach workers have employment contracts, or at least have their social security secured while they're performing their job. Volunteerism is also very good, but the heart alone will not feed us, says Inad Rendon. Okay, so we have one last question, and unfortunately we have to move on with the program. But then here we have a question from Manor Pardeshi, and Manor asks, "What is the role UNAIDS plays to regain the community space in the HIV agenda?" Okay, go ahead,
yeah.
Amon.
Thanks, Pia. I can answer from a UNAIDS biased perspective, but I think Sita and other colleagues should be talking about this, and what is needed in each country is different. But just the very nature of this report being so different from a standardized report on progress, and talking about the important issue of leadership of community. And the political declaration, the hard work that went in to get these targets and get countries to agree for these targets is part of that work. But we're seeing a slippage, and you said communities at risk, in need of protection. The rights are being eroded in places. So in some ways, to remind the world of what they agreed to 30 plus years ago and where the great successes were achieved with community in the lead. So UNAIDS' role at country and regional and global level is to amplify this message and get it back out there that we are seeing a slippage for a whole range of reasons, being that rising conservatism, being people with fatigue of the response, being that a whole range of different reasons, slipping into a more biomedical model in places and misunderstanding the vital role, not just for HIV. We saw great results in COVID where communities were engaged from the outset, and we'll need that for the next pandemic. And so that lesson from HIV needs to be reminded. So we'll be a loud advocate, but it's important for people in the discussion as the session moves forward to talk about what's needed in different places across the region. Thanks very much, Pia, and thanks for the question.
Thank you so much. Now, everybody, I know we have a few more questions, but they will be noted and will be answered later on, either here on screen or in the chat box. So how do we reach key populations? The key is key population-led services. Check out this stellar example from the Rainbow Sky Association of Thailand. Please watch this.
ตรงที่ค่อนข้างแบบบางทีชื่อจริงเราก็กลัวคนเห็นเราก็รู้สึกอายคนนิดหน่อยอะไรประมาณนั้นนะครับได้ระบายได้ความสบายใจกลับไปแล้วก็รู้ผลแบบชัดเจนครับมีคนบอกทุกขั้นตอนไม่ได้ดูยุ่งยากแล้วก็วุ่นวายมากครับ
บริการเป็นคนข้ามชาติเดินเข้ามาที่ฟ้าสีรุ้งได้นะครับเพราะว่าเราเชื่อว่าทุกคนคือมนุษย์แล้วฟ้าสีรุ้งเป็นเพื่อนคุณให้ฟ้าสีรุ้งดูแลคุณนะครับของการเลือกปฏิบัติไม่มีเรื่องของการตีตาเนี่ยเกิดขึ้นแล้วเนี่ยบริการของเราเนี่ยมันก็จะเป็นมิตรกับเขาได้มากขึ้นและเมื่อเราเป็นมิตรกับเขามากขึ้นเขาจะเข้ามาสู่กระบวนการทำงานร่วมกับเราครับที่ฟ้าสีรุ้งเชื่อเรื่องการทำงานร่วมกับชุมชนถ้าชุมชนมาทำงานร่วมกับเราสามารถตอบสนองความต้องการของชุมชนได้จริงปัญหาที่เกิดขึ้นในชุมชนแต่ละอย่างเนี่ยจะถูกขจัดและหมดไป
Concept is all about exchanging knowledge to strengthen our work. The report features a case study on the Test BKK campaign. Test BKK uses social media to reach young men who have sex with men and transgender people with targeted prevention information and increased testing. In today's panel, we'll hear from 3 community leaders on how they use online spaces to drive HIV prevention and testing among young MSM. So here in the panel, we have Siripong Arm Srichao, Test BKK campaign officer from APCOM based in Thailand. We also have Karahana Marian Shloven, the media campaign and communication coordinator at GWL INA Indonesia, and Viet Trinh, program director of Lighthouse Social Enterprise in Vietnam. So everybody, please remember to leave your questions for our panelists in the chat. And I will start by asking all of you the same question. Data from some countries in Asia Pacific suggest that the HIV epidemic is growing in young men who have sex with men. What insight can you share from community and country perspectives about why this is so? Arm, we can start with you.
Okay, so hello, I'm Arm Siripongsichira, the campaign officer from APCOM Foundation based in Bangkok, Thailand. So for my campaign, we're going to talking about Test BKK. It's really cool initiative as we have like a lot of things to engage with our key population, like the web series Gays Okay Bangkok season 1 and 2. We have game show, we have talk show, and yes, we have like social media channel that focus on sexual health, especially for young MSM and transgender in Bangkok. Like the main goal to raise awareness about sexual health, safe-sex practice, chemsex awareness, and promote regular HIV testing. So very important, right? Before we driving into my campaign strategy, why Test BKK can catch the attention of young MSM and transgender people in modern days of Bangkok, I would like to set the scene on PrEP situation in Bangkok. PrEP or pre-exposure prophylaxis is a breakthrough in HIV prevention in Thailand. However, despite its effectiveness, there was a time when access to PrEP in Bangkok was limited, leaving many in the MSM and transgender community without this crucial preventive measure. So here, how we address this through our impactful campaigns, specifically the PrEP provision campaign. So the first one, we understanding the audience. We tap into the need and lifestyle of young MSM and transgender individuals. This understanding was vital in shaping our PrEP campaign to address their specific concern and preference. So the second one, we make the engaging content. For the PrEP campaign, we create content that was not only informative, but also resonate with our audience experience, making the complex topic of PrEP accessible and relatable, make it relate to our audience and mirror their lifestyle and link them to the service. And next one, yes, especially me, making yourself as a social media savvy. Like we're leveraging our social media expertise, we amplify the PrEP campaign and other campaign message through both organic reach and advertising. This approach result in like, at that time, over 6,000 signatures on change.org in just only 7 days and reached like 3 million views on Twitter or X, highlighting the community demand for better PrEP service at that time. And the next one, for Test BKK, we work with influencer and online network. We collaborate with influencer and online network in the LGBTQI+ community to give a stronger voice to our campaigns and extending its reach and impact. And so the last one, we have the feedback and adaptation. The response to our campaign, the PrEP campaign, was a clear indicator of its success, as we saw a significant increase in PrEP uptake and testing, and also the blood test also, affirming that the effectiveness of our strategy and guiding our future effort. So by integrating these strategies together, our provision campaign and other campaigns highlighting that test BKK ability to effectively respond to community needs. It's what all about understanding our audience, creating engaging content, using social media strategically, collaborating with influencers and online network, and adapting based on community feedback. This comprehensive approach not only raise awareness, but also play a crucial role in improving access to PrEP and HIV testing rate in Bangkok. So, thank you.
Thank you, Arm, for sharing that with us. That's such a great model, role model for other Asian countries as well. But now let's hear from Karahana. Please tell us about the dynamics at play in Indonesia.
Okay, thank you so much, Pia. It's an honor to be here. My name is Karahana Marian Splavan. I am the media coordinator of GWLINA, as well as the project manager of Test JKT. I probably will answer the earlier question about the HIV prevalence in young men who have sex with men is getting higher. So maybe the first one is tracing back from the beginning. I was talking about this issue as well in Bangkok on July, if I'm not mistaken, especially on young key population. The first one is always, I'm always trying to highlight the lack of proper sexual education on formal education that in our places, then makes it hard for all the young key population, that is also including MSM as well, to know about sexual health, about HIV and other things. And then the second one is also the number of stigma and discrimination on HIV itself on systemic level that hinders them from accessing health facilities. Because like based on experiences and also what happening around the country, there are a lot of MSM who actually want to get tested on the health facilities that are being provided by our country, but the number of stigma and discrimination hinders them from doing so. Other things is the way we see it here is the number is getting higher because MSM nowadays are among the population who is aware of their sexual health and get tested more. So that's the high number, because even if all the people getting tested equally, I believe the number wouldn't be so much different. But because MSM nowadays are very aware of their sexual health, about what they're doing, what's best for their sexual health, that is why the number is getting higher and higher. I think that is what I would like to respond about the first question. Yeah, thank you very much.
Thank you so much, Karhana. And Viet, please tell us how Lighthouse designs a social media campaign that actually drives the uptake of HIV prevention and testing services.
Thanks, Pia, for the question. Hi, everyone. My name is Viet. And I think like from the RSAT video, like that already kind of like showcased the possibility of a community-led service delivery. And here at Lighthouse, whenever we do any social media campaigns specific to public health, we make sure that we highlight that. We highlight the fact that there can be medical services that can be provided by the community, where you could get services, at a peer-to-peer level, where, there are very little, power dynamics that you would often see at like hospitals or like national clinics. And oftentimes, when you're entering, like a community-led clinic, a lot of these services here are tailored to your own needs. And what that means is that whatever needs that you have or you're carrying, to the clinic, you can be assured that there are like a wide array of services that are going to be tailored to your own needs. And lastly, we make sure to highlight that, with the community-led service delivery model, the service is going to be affirmative. And what I mean by affirmative here is what I'm going to segue into my second point here, is that for a lot of these social media campaigns that we promote here at Lighthouse, we make sure to leverage the affirmative approach in promoting health focused behaviors. And what I mean by being affirmative is, it's the fact that we counterbalance common public health perspectives with sex-positive language. We acknowledge the fact that sometimes, like a lot of different public health, messaging strategies could accidentally stigmatize communities, for their risk behaviors, quote unquote, and result in their, apprehension of seeking healthcare. As we understand that, we make sure, to mainstream sex-positive language in order to normalize sexual needs, by the community. And at the same time, we're still sending factual knowledge that is rooted in science. And what I also mean by being affirmative when we're promoting health-focused behaviors is that we're highlighting a continuum of care, and we're trying to emphasize the fact that we need to meet the community as for where they are. And as we understand that a lot of different key populations, especially young men who have sex with men, they have varying experiences of shame and stigma. So these different key populations, they may come with different needs and readiness for service uptake, and that does not mean that we should deter them from receiving whatever needs that they need at that current standpoint. So I think we need to acknowledge the fact that there's no one size fits all, and we need to give the community multiple choices when it comes to choosing whatever services that they need at that point. So I think those are some of the ways that we promote social media campaign here that drive the uptake of HIV prevention and treatment for young key populations.
Thanks for sharing that with us, Viet. I want to go back to Karhana. How did JWL INA adapt the Test BKK concept to make it work for Indonesia's social, cultural, and policy context?
Yeah. Thank you, Pia. So if Bangkok has Test BKK, we're actually a sister project. We're called Test JKT for the name of Test Jakarta, actually. And we make it kind of the lighter version of Test BKK, actually. We cannot just use shirtless man pictures on our social media because it's going to get us a lot of backlash. So how do we do that? Is actually we're using memes. We're finding something that is very relatable to our audiences. Our audiences is ranging from 18 to 34, mainly MSM, gay men, and transgender women. And we're actively seeking for memes, for videos that they will find interesting for them, and we're catering to them that way. And then also, we're constantly very active on Instagram stories. So if people are usually not really active on there, we're actually very active on Instagram stories. We're uploading a lot of songs, quotes, plans, or doing the trend that are happening right now. The second one is actually we mainly post about education, research findings without making it boring, because we would like to put our essence into our post or our campaign, but still make it very accessible for everyone. And then the third one is we're currently now in political year, and we're being told, and we're also aware to tone our campaign down a little bit, because usually in our country, whenever there is a political year, the main issue that is going to be brought up and become one of the big problems is actually LGBT people. So we're trying to make our campaign as safe as possible for everyone that is in the team right now. And then number 4 is actually we rely on videos. We have 2 influencers, that's how we call them. And they are the representative of our target audience. One is a gay man and the other one is a trans woman. And people actually like our contents because we make it as relatable to them while still keeping the essence of the information that we're getting. And then we're also using slangs because nowadays young people, they don't really like to read a lot of information if the languages is too formal, so we're using slangs. And the last one is actually we adapt the language and key message from Test BKK, but make it softer so to fit our cultural. Because I cannot say the word in here, maybe you guys can look it up later. In Test BKK, in all the tests we have 4 words. So Test BKK have something, something, test, and repeat. But in Jakarta, we use fun, love, test, and repeat because we're going to make sure that it's actually fit the culture and we're not going to get any backlash. I think that's all. Yeah, thank you very much.
That is very insightful to hear. Of course, even though we are Asia, Indonesia is still very much different culture from Bangkok, as from the Philippines and Vietnam. And it's very nice to see all the different kinds of approach that we're doing towards this advocacy. We have a few questions, and please, guys, if you do have any questions, you still have some time to please put them in the chat box below, and we'll try to answer your questions. I do have a question here for ARM. And what is the key to supporting young MSM to use condoms and lubricant correctly and consistently?
I just got that thing. We for condom and lubricant, we'll make it at a safe play pack. So in one pack, we will put the condom and also the lubricant in one pack, like 15 condom and 15 lubricant also. How to encourage them to use? Because like I work with influencer and also like the people that in X, and yeah, they have the OnlyFans account. So I let them speak in their voice to normalize using the condom, or how to practice the safe sex through their voice. So that so it's like the main media that for young MSM in Thai, everyone that in that platform. So to use influencer is normalize this kind of thing, and it's increase the rate to use the condom also. And in each month for Test BKK, we distribute the safe play pack like 200 to 500 pack per month for free to the key population that request by online form. Yes, and like today we adapt it onto like the online shop, but we don't sell it. We just put the product there and give the free coupon for them to get it by the online.
That is a very clever way of getting more people to effectively use condoms and lubricants consistently. Thank you so much. I have a question here for Karahana. How does GWL-INA ensure that the people you serve understand how to use PrEP properly?
Thank you very much for the question, Pia. So actually, we're very active on our online campaign. So in GWL itself, we actually have two main purposes. The first one is demand generation, or how we call it is actually online campaign. And the other one is actually community strengthening. So for the first part of the community strengthening, we usually go to other districts. We're giving them technical assistance. We're giving, we call it focal point in here. We're giving them assistance about how to deliver PrEP, deliver information about PrEP to other people, as well as also doing the second part, which is the online campaign. And we're actually very active on social media. If other campaigns, I would say, do it once a day or 2 days a week or something like that, we're actually posting 6 content per day. So people are actually flooded with our information. We used to think that maybe this much information is not going anywhere, but from recent findings, the data that we got on, if I'm not mistaken, it was on July, actually 40% of people who are accessing PrEP is actually finding it out from social media. So we're actually find it to be reliable, and we keep doing it because we believe that if something is actually showing a very good result, we should keep doing that so people get information all over and all over again. I think that's it. Yeah, thank you very much.
Thank you. Thank you for sharing. My next question is for Viet. What is the value of having an LGBT plus specific clinic?
Wow, I think that is like a very terrific question. I think what is so special about having an LGBTQ plus specific clinic is the fact that there aren't many of them out there. And, you know, like, especially the fact that, you know, with public health, it's just so much associated with, you know, prevalent and commonplace stigma and discrimination. I feel like a lot of folks out there who are sexual and gender minorities do not find themselves safe in such spaces, let alone going to those spaces, you know, and being vulnerable about their sexual behaviors and seeking the care for their own needs. So I feel like going to these LGBTQ plus specific clinics would allow them to feel safe first, also to seek empathy from their own peers who are also LGBTQI plus. And then like the last point that I made earlier, being affirmative, you know, so like they'll get affirmed about their own needs. So like they're not going to be like gaslit about the fact that, certain behaviors of them are, are gained on, but instead it's on a different level where like they get to understand that like they could take an active role and take care of their own health. So I think all in all, I feel like the presence of having more LGBTQI plus specific clinics is just so very important.
Thank you, Viet, for sharing. I see that we have a few more questions actually, but unfortunately we are running out of time. But I do want to thank our panel for today, Arm, Karahana, and Viet, for sharing this very insightful information with us, sharing the different approaches that you're doing in your respective regions. I really do appreciate it. I see a lot of questions in the chat box, and we will be answering those questions. We are going to compile them, and UNAIDS will answer them and disseminate the questions via social media very soon. So we're taking note of those questions, and we will answer them as soon as we can. Thank you. Thank you so much for our panelists. Okay. Now we turn to the Philippines to learn about a community-led initiative to improve the quality of reporting on HIV by the news media and combat stigma and discrimination. For this case study, please welcome Noemi Leis, Program Manager of the TLF Share Collective. Hello, Noemi.
Hello, Pia. Nice to be in the panel with you. Thank you very much for inviting me, UNAIDS, to this important forum. Okay, shall I request the tech to please show a video, a teaser of our video for the upcoming WAD event in the Philippines. So it's going to be a teaser. We're going to launch a series of videos, but this one will be just the first one. Please.
Ako si Jeb.
Ako si Drew.
Ako si Bobby.
Ako si Athena.
Ako si Rika.
Ako si Dream.
Ako si Terry.
Ako si Benji.
Ako si Eros, at may gusto ako sabihin sa'yo.
On World AIDS Day, listen to the stories of courageous persons living with HIV and their families. Stories of courage, joy, and inspiration. Aim to fight stigma and discrimination. Listen to their stories and share yours too.
Kani mo na akong istorya sa akua.
Ikaw, anong kwento mo?
Thank you. Please watch for the next, for the other videos to be shown in UNAIDS Facebook page or TLF Facebook page. Let me also acknowledge Jeff Hernandez, who is a media practitioner who led the development of the videos. And thank you, UNAIDS, for the support of this video. Now I'd like to present about the media, the human rights, HIV, and the media in the Philippines. And next slide, please. Let me introduce TLF first. It's a community-based organization established in 1990. It was composed of peer educators, trainers, and advocates who responded to the call of the Department of Health when the epidemic started in the Philippines. They were all volunteers. And now, because of its consistent involvement in the advocacy, it became a member of the Philippine National AIDS Council and one of the key movers in the development of the two laws, the RA 8504 and the RA 1166, which was repealed in 2019. It also became a sub-recipient of the Global Fund the Global Fund for AIDS, TB, and Malaria, focusing on human rights and HIV. Its areas of work are mainly on human rights, sexual health, HIV and AIDS, SOGSC, and mental health. Most of its activities are on training, knowledge generation, such as the one that you saw earlier, policy advocacy, which is our core strength and development. And with that, all the core of that of these activities is the community, which is why community mobilization is important for TLF. Next slide, please. Okay, currently, cumulative data of the Philippine HIV is 117,946,000. These are the reported cases by the Department of Health until June 2023. And just relating to Emon's representation earlier, the annual increase has now raised to 418%. And it's one of the fastest growing epidemic in the Western Pacific region. And majority of it is through sexual transmission at 96%, and mostly through male having sex with males. And it's important to note that 15 to 24 years old is 29% of that epidemic, of that data. So we're seeing more and more young people getting infected. And we have MSM, transgender women, people in sex work, and PWID and PWOD. We cannot disaggregate PWOD from PWID because PWOD is the entry point for people who are into PWID, into injecting drug use as well. So for our accomplishment on the targets, the 95 targets, Philippines is lagging at 59, 64, and 32. So out of the estimated HIV, PLHIV in the Philippines, only 59% was tested, 64% is into treatment, and 32% of the 64% is virally suppressed. It's quite low. So next slide, please. Our challenges is mainly structural, leadership, governance, and everyone has discussed about this, and funding. But let me focus as well on the historical, social, and cultural aspect in addressing HIV. And that's where religion, stigma, and discrimination come in. So it's really important that we from the community, we from the program managers, we from the policymakers would always consider the historical, social, and cultural aspect of HIV and AIDS. Next slide, please. Okay, because I'm tackling more about the media coverage in the Philippines. Media, news, newspaper, TV, radio news, has a high patronage among Filipinos. It's a favorite pastime in the countryside. But when it comes to covering HIV news, we face a lot of issues like inaccuracy. Sometimes our names are not even recorded properly, much more the data. And they tend to sensationalize this issue. So it's creating more fire. It's promoting more fear, promoting more stigma among the viewers, among the listeners. And to that, it leads to insensitivity of the people who are living with HIV, and even among key populations. Because once they report about PLHIV and sensationalize it, key population tend to back out or tend to be not to get or access the treatment or the services of the community and the government as well. Okay, next slide, please. Okay, let me give you some samples. If you notice on the left, the picture on the left, there's Boya Bunda. It's one of the famous hosts in the Philippines, famous showbiz personality in the Philippines. He just took the test, but the media reported it, that created the tribe's fear and focuses on sensationalism, and that HIV can be tested, or HIV can be tested, but it's not clear whether AIDS can be tested as well. So they tend to use the two acronyms interchangeably. So that's where also accuracy comes in. in this sample, we have a recommendation on how can this be more non-discriminating, would promote more people to take the test. So the X ones are the ones that we think are not good about this news. The check ones are the recommended headlines. On the right, Miss Pia, don't get me wrong, huh? You are confidently beautiful with a heart. And that's really true. You walk the talk. But the media, in one of your statement, was actually misquoted. So they used the word PIDEA. It's a drug enforcement agency. Tinalakan ni Pia dahil sa drug suspect na may AIDS. In English, it's like PIDEA was, oh my God, I'm sorry about my English. It seems like Pia bad mouth the PIDEA because of a drug buy bust and identifying those people who are HIV positive. So when they have this kind of news reporting, drugs, sexuality, and HIV are compounded in one report. And if you label them as drug suspects, it can be harmful. Many of us would be aware that there's a strong war on drug in the Philippines some years ago. And it's silent in the news, but it's still happening right now. So people, even if they are not proven to be using drugs, can be labeled as drug users and can be victims of war on drugs. So we recommend that the headline should be revised such as this: Pia Wurtzbach speaks out versus PIDEA for revealing suspects' HIV status. So that's the English version. But in this part also, the one of the lines, the red one, actually praised Pia, but there's a link between bakla, being homosexual, and being HIV positive. So those are the two things that we can give you as an example. There are a lot of that. And the media in the Philippines really shape the people's perception, the people's belief on whatever issues that they could deliver. And because of social media and because of people not verifying news and the facts behind it and the science behind it, that's where we're having problem. Okay, next slide, please. Can we have the next slide, please? Am I still there?
Yes, we can hear you.
Okay, there. Okay, so what have we done because of these issues in the media? Way back in June in this year, the UNAIDS and UNDP organized a workshop in Bangkok to talk about HIV-related stigma and discrimination. The composition, this was a rare opportunity for us, no? Because it was the first time for us to come together, the HIV advocates, the government representatives, especially from the justice system, from the welfare system, from the human rights. So we have the media practitioners, they were there also. So the team came up with a plan because of the so many issues that we've talked about. One of the solid or the key plan that we agreed on was to scale up HIV news reporting. Okay, so what did we do? Next slide, please. We developed the Empowered Stories. It's a media guide on HIV reporting. It's actually a very, very small, can you see it? It's actually a very, very small booklet. It's a 32-page booklet. So you can pack it in your bag, you can carry it anywhere, you can share it with anyone, and it really, it's very concise, but it talks a lot about HIV, human rights, the science, and how can we be more kind? How can we be more politically correct? How can we be more empathetic to the person who are living with HIV and the key population? And the good thing about this is that this was made in collaboration with the community, the PLHIV community, the media, practitioners, even the ones who are based in Bangkok, the ones who are based outside of Metro Manila. So this is a very, very widely consultative, widely developed, or the consultation was widely done for us to come up with this in a very, very short time, but we're happy that we were able to pull this off. Okay. On the right side, we had this launching just yesterday with the media, and one of the broadsheets in the Philippines covered the event, and we had the Assistant Secretary Beverly Ho, who was there. We had Dr. Louis from the UNAIDS Philippines, the community, the PLHIV community, na Elena, and Tasing Marasigan, my executive director, also Ms. Mara Quesada, who actually did the first booklet on media guide. So we updated it. It's a 10-year document, and we updated it after 10 years. It's just in time for the Human Rights Day, World AIDS Day. Okay, next slide, please. Okay, the one that you saw earlier, it was a teaser. And this is how many videos we have. 1, 2, 3, 4. We have 7 more videos, and we have 6 more videos, and we have engaged a lot of people to be engaged. We have vloggers as well, to scale up news coverage. So we would like to honor as well the PLHIV community, because this is part of our visibility is the key campaign. For so many years, PLHIV in the Philippines will not come out, will not show their faces. Most of the time, their faces will be blurred, their voices will be changed. So this time, the media told us, why don't you be brave enough and show the world that PLHIV, being PLHIV or having HIV is not a curse. So we have beautiful people here. We have courageous people who bravely took the challenge of being visible for the World AIDS Day. Okay, let me have the next slide, please. Okay, on December 9 to 10, we'll have another session, a workshop on media sensitization training. This will just a kick-off activity for us to plan more for next year. The event will be a dialogue with the media, and we're going to talk about human rights, HIV, and the law. And we aim to strengthen the role of the media in the HIV response. So we're also including broadsheets, we're including some people from the media, from the broadcast news. The media will be segmentized in the Philippines. So there will be more and more activities. And this group of media will be part again of another planning session during this event. And we will have media practitioners also who are advocates or HIV advocates who will be joining us during this event. And then next, please. Okay, PLF has produced many videos for the HIV and human rights. We've been able to get commissioned Karen Davila, Karen Kalad Karen, one of the famous icon of the LGBT community in the Philippines. So she talked about the law in a very, very fashionable way. But I'd like to end my talk. This is my last slide. So this video, this media guide, this booklet was also developed by Jeff Hernandez, one of the representatives during the Bangkok workshop. And he came up with a very, very short video that can be used by the media practitioner in a very, very quick way in your telephone, in your social media. And I would like to show it with you and share it with you. And please feel free to download it, Cedrian will provide the link to it. You can translate it. You can use it in any way that you can use it. And if you need a copy of this, we also have web-ready copies, and we also have printed copies, because back in the countryside, people don't have strong internet connection. So that's all for my presentation. Thank you very much for listening. And maybe I can ask the tech to show that short video about the media, empowered stories for media practitioners. Thank you.
We are presenting the Media Guide in HIV Reporting, a way to empower stories of people living with HIV. Because journalists need to tell stories about HIV in an ethical and empowering manner. Because you hold the power to end stigma and discrimination. First, a few reminders. HIV is not a death sentence. HIV is not a gay disease. HIV and AIDS are not the same. There are a lot of misconceptions about HIV. And as storytellers, it is our responsibility to change the narrative. HIV 101. The HIV, or the human immunodeficiency virus, attacks the immune system, making it hard for the body to fight infections and illnesses. It can be transmitted by certain body fluids from persons with detectable viral load. People living with HIV can take antiretroviral therapy to maintain an undetectable viral load and live long and healthy lives. We can also prevent the spread of HIV through the use of condoms and PrEP. Those with the risk of exposure may also take PEP within 72 hours. There is a declining trend of HIV incidences globally, but the Philippines has a different situation. We are among the countries with the fastest growing HIV epidemic in Asia and the Pacific. To lessen this number, a good starting point is ending stigma and discrimination towards people with HIV. When there is stigma, people tend to shy away from testing, contributing to higher numbers of PL-HIV nationwide. That is why it's important to use your platform in ending stigma and discrimination. So how do we tell stories about HIV in the media responsibly? First, let's debunk misconceptions. The following do not transmit HIV: shaking hands and hugging, toilet seats and swimming pools, kissing, sharing utensils, glasses, food and drinks, sneezing or coughing, public spaces and surfaces, sweat, tears and saliva, and insect bites. There is a law that protects people living with HIV. Republic Act 11166, or the Philippine HIV and AIDS Policy Act, makes it unlawful for media practitioners to disclose that a person has HIV, is undergoing treatment, or is exposed to the virus. The media may only disclose the information when persons living with HIV waive confidentiality. Misinformation on HIV and AIDS, including false advertising and claims, is unlawful. Now here are some guidelines on video reportage about PL-HIV. Number 1, we have to use people-first language to shift the focus from the virus to the people living with it. Avoid stigmatizing terminologies like victim, HIV carriers, HIV positive, and infected. Instead, we should use people or persons living with HIV. We should not describe HIV as incurable, dreaded, or deadly. Instead, let's say treatable condition or medical condition. It is also important not to link the sexual orientation and gender identity of a person in telling stories about HIV. So we should avoid using bakla, bading, gay, lesbian, transgender, or any similar terms in our reports. Instead, we should use tao, lalaki, or babae as more neutral terms devoid of judgment. There are also other loaded terms like drug addict, drugista, or prostitute. Let's not use them. Instead, let's use terms that will not marginalize these people. We may use people who use drugs, or people who inject drugs, and sex workers. Writing stories about getting tested, especially when it's popular personalities and influencers are doing it, is highly encouraged, as it helps end stigma about this medical condition. But it is important to note that we should not discriminate those who took the test or those who tested positive. It is also important that linkages to HIV care services are provided when writing about HIV testing. When conducting interviews, always remember, ask for consent. Ask for consent whenever you take photos or videos. Ask for consent whenever you ask questions. Ask for consent before publishing or airing names or images. We should also be conscious of our tone and allow our interviewees to pause. Never ask them for unnecessary details like how many sexual partners they've had. Respect them if they decline some of our questions. If they consent to an interview but they don't want to expose their face, use a natural silhouette like the use of a backlight. Do not also morph the voice and have someone dub their sound bites instead. It is also important not to make them appear like criminals in hiding. And avoid stigmatizing headlines like this, and this. There are a lot of empowering stories about HIV that we may report on. We may tell stories about the advocacies on HIV, medical advances, community initiatives, personal profiles, prevention and education campaigns, and policy matters. Always remember, through responsible reporting and empowering storytelling on people living with HIV, you can help end HIV stigma and discrimination, and together we can end AIDS.
Wow. Thank you so much for sharing that, Noemi. It is really so important how the media reports HIV and AIDS, and responsible reporting really is so important. There's so much we can do as advocates, as community leaders, as influencers, but the media has such a powerful voice in this too. And creating a campaign like this is so, so important. So thank you so much for sharing that. We really enjoy that. And I hope other regions and other nations can also follow suit. Thank you so much, Noemi. So now, everybody, it's your turn to share with us. Please take out your cell phones and your laptops. We're going to do a little activity. You can go to mentimeter.com. I think it's flashed on the screen, mentimeter.com. And please put in the code shown on the screen. That is 52578641. We're going to do a little activity. This is going to be very interactive. So once you are in, we're answering two questions. The first question is, what advocacy priorities from the 2023 World AIDS Day report are most relevant for your work? Please type in your answers. So I'll give you guys a little bit of time. So the website is Mentimeter, MENTIMETER, and the code to get in, if you need the code again, it is 52578641. Okay, we have a few answers already. Prevention. Advocate for government to adopt the 30-80-60 targets. Demedicalizing HIV interventions. And oh, we have more answers coming in. More answers coming in. Thank you so much, guys. Funding going to communities for community-led initiatives. I agree with that. Permit to lead community from government. Prevention. Key population prevention. Increasing the role of communities in HIV service delivery. Yes, this is also very, very important. Okay, we're refreshing the page as more answers are coming in. We got 17 responses so far. Support community-led organizations. Empower funding to communities for their initiatives. As we saw in the report before, the funding has gone down since a few years ago, which means this is something that we really need to amp up. Abolish stigma and discrimination. Okay, we do have a second question. I think everybody was able to put in their answers already. If we're ready for question number 2, that is, what communication or advocacy strategies will you explore to advance this agenda? Let's wait for some answers. What communication or advocacy strategies will you explore to advance this agenda? We're just taking a little bit of time to get some answers in. Okay, we are loading. We got 4 answers already. Social media, yes, very, very powerful tool. Social media and online campaigns to educate more people, especially young people. Everybody's on their phones nowadays. Everybody is going through social media for knowledge, for information. The power of social media really is very strong. Filmmaking, that is also a powerful form of media to get the message out there. News media engagement, advocacy, TikTok reels and short form videos. I agree with this very much. Kids nowadays, the target audience nowadays, they have such a short attention span, and they are on these apps, they are on Instagram, they are on TikTok. So to get the message out there in these platforms are so important, because that's where they get their news from. Plain speaking and honest information. Learning from Test BKK, Test JKT, and Lighthouse experiences. Yes, as we've heard earlier. Social media, media platform, social media and behavior change. This is very important. As we heard earlier, there is testing and treatment available, and it is accessible, but it is the behavior that has to change. So I see social media being the #1 response here, actually. Okay, we got 30 responses now. Social media, online engagement. Social media really is a powerful tool. Okay, well, thank you everybody for participating in this activity. It's nice to see each other's answers. I know that we can chat with each other on the chat box, but it's just nice to see all of our answers being flashed on the screen and to see what our agendas are for the next year. Okay, in the next coming years. All right, thank you so much for everybody who participated. To deliver the note of thanks, I want to welcome another 7 Alliance representative, Francis Joseph, Regional Coordinator of the Network of Asian People Who Use Drugs.
Thank you so much. Dear all of you lovely people, good afternoon. It is with immense gratitude and profound sense of inspiration that I extend my sincere thanks to each one of you for your participation in this powerful webinar, Let Communities Lead. I thank you for the collective energy, commitment, and passion that has fueled our journey throughout this webinar. It is really despairing to see that 96% of the new infections in Asia and the Pacific is primarily affecting the key population groups. Asia is home to the most vibrant communities and has a proven track record of community leadership. In this fast-paced world where digitalization is the in thing, I would like to highlight that communities can proficiently lead in these efforts, as we have already heard from our esteemed colleagues from APCOM, the regional network, GWL-INA Indonesia, and Lighthouse Vietnam in our panel discussion on social media strategy. Sure enough, I would like to echo to what Eamon said in his opening speech, that the 3 broad takeaways are surely the key to success. 1, putting communities at the centers of all levels when it comes to planning of programs and implementation, and at the policy level, policy and decision-making level on issues that affect our lives the most. 2, sustainable funding and adequate remuneration for all community members who play significant roles. And lastly, ensuring civil society space and protection of human rights of all people. First and foremost, I would like to express my sincere thanks to a heartfelt appreciation to all the distinguished speakers and panelists for their insights, expertise, and experience that has illuminated this discussion. Your valuable perspective and the passion for community-led initiatives has ignited the flame of inspiration that will undoubtedly guide us as we move forward to our collective efforts. A heartfelt thanks to our participants who have joined us from across the Asia-Pacific region. Your active engagement and thoughtful questions, and also the Mentimeter exercise, enrich the depth of our discussions, creating a vibrant and inclusive platform for learning and collaboration. As we reflect on the insights gained on our shared exploration into community leadership, let us carry the spirit of collaboration and community-led efforts in our respective spheres. May the insights gained today serve as a catalyst for transformative action within our communities, fostering a sense of empowerment and resilience. In conclusion, thank you all for being part of this meaningful discussion. Together, let us continue to champion the cause of community-led and collective efforts, recognize the power that lies within our communities, and bring about positive and lasting change. May the spirit of community leadership guide us the path ahead. Thank you.
Thank you. Thank you so much for sharing those words with us. Okay, guys, thank you. Thank you so much. I want to thank everybody who joined our discussion for today, community leaders from all over the region. Amon, thank you so much. For everybody who's watching also and everybody who sent in their questions. Again, we are taking note of those questions. UNAIDS will be answering them on their social media. So just look out for it. We'll be doing that very soon. I'd like to thank you for everyone who tuned in and for our audience as well from different parts of the world who have tuned in even up to now to the last few minutes of our discussion. Thank you, thank you. We learned a lot today and we heard some very meaningful insight from everybody. Thank you so much for attending our event today. And we hope you leave with not only prioritize to maximize the impact of communities, but also tools to amplify your voice and to let communities lead. Again, my name is Pia Wurtzbach. It's been an honor to be your host for today, an honor to be an advocate of this advocacy, and I will see you guys again very soon. Mwah.